Every day, someone is telling you that testosterone is dangerous. And why do men get it, but women aren't often prescribed testosterone? That's the subject of today's Your Story, Your Health, Your Best Life.
Today, we're going to talk about one of the most misunderstood hormones in medicine, testosterone.
Yeah, because I don't think a lot of people realize, especially women themselves, that we naturally make testosterone, just like men naturally make estrogen.
That's correct. But we make it in very different levels. So an optimal male may be 9 to 1200, and an optimal female may be 120 to 150.
The testosterone game, though, is growing. Now, men have always been prescribed testosterone. You're getting a little limp in the bedroom, boom, testosterone. You want more muscles? You got your testosterone. Women have been sidelined for a really long time, but we're starting to realize in so many ways, whether combating osteoporosis, being better in the bedroom, feeling better, brain fog. There's so many reasons that women should explore testosterone as part of their hormone replacement therapy. Maybe not for everybody, but you should at least have somebody knowledgeable take a look.
And a lot of times we don't even test women for testosterone. So we'll test for the basic female hormones of estradiol and progesterone, but a lot of basic panels for females on hormones don't include testosterone.
But testosterone is a little bit more complex than I think people realize, because you really need to do a deep dive into what's going on at a functional level with your health with a functional medicine specialist like yourself. And maybe that's one of the main reasons that a lot of OBGYNs aren't prescribing this to their patients, because they don't really know how to handle it or what to look for in the blood markers, because unlike other things, more isn't always better when it comes to testosterone.
And that's true. I trained originally in traditional medicine. And when my hormonal journey began, I thought, I need estrogen. Something's off, because we notice a change in ourselves. So I went to a hormone clinic, and it wasn't the best experience, I have to admit, but I left with a box being mailed to me, and I opened it and it was testosterone cream. And I was like, oh my God, they think I'm a man. Like, they have completely missed the mark. And I did Dr. Google, and I realized, all these crazy things, and I didn't take it. But what I learned through the years, what testosterone really is for women. So testosterone for us is our brain health, and it starts depleting about age 30. By 35, most of us are depleted, but that's when they're also saying, you just need an antidepressant.
Don't even get me started on the antidepressant,
you're
but
just
go ahead.
suffering because you have children at home. We are feeling that depletion early. You're putting on weight. That's just, we get all these excuses. So what is testosterone? Number one is our brain health. So when testosterone is optimized like it was in your 20s, we're very focused, we're very creative, we're entrepreneurial, we're starting businesses, we're just full of life. When it's depleted, we have monkey brains.
Yeah. It's true. And isn't it great for bone health?
It's great for bone health. It's great for mental clarity. So when you're feeling down and depressed and you don't want to do the things that you used to enjoy, and you're getting mad at your spouse or children and you don't recognize yourself, it's probably low testosterone.
So let's go back to why women aren't prescribed testosterone, but men are. And again, testosterone many times will be bundled into, if you're going for hormone replacement therapy, with progesterone, estrogen, and testosterone. So like that, for me now, I'm on all three. But at the end of the day, because of the failed Women's Health Initiative 20 years ago, this is new to a lot of women. I mean, they've just basically been white knuckling their way through life when really they don't need to. There's so many benefits for women, but why is it so easily attainable for men and so difficult for women, even more expensive, I might add? And insurance doesn't even cover it for us.
Because men, they've known the diagnosis of hypogonadism. That's what it means, low testosterone. And it has an ICD-10 code that's billable. So insurance companies recognize coding systems, billable systems, things they can put through. There is not a diagnosis for low testosterone in women other than saying hypogonadism, but we don't have gonads. So it's kind of a crazy diagnosis. So it's coming. The FDA met last summer, and it was a 3-hour roundtable. And I said, I'm going to watch it. I'll probably need a drink 10 minutes in because it's going to be really, really tough to watch. But I was so excited 5 minutes in that I was texting every hormone expert I knew. And what they saw was they brought to the table evidence that not only is testosterone good, it's necessary for women, but women need testosterone, and providers like ourselves need to be retrained to recognize low testosterone in women and restore testosterone. And insurance companies and plans need to catch up with the current needs of their patients.
So how is testosterone delivered? I know how I take it, but I inject a trace amount. But what are other ways? What are other modalities?
So it's interesting, and it depends on what part of the country you're in. And me telling you this on a podcast, I'm going to probably offend half of my providers because we all learn how to do it through our outcomes. So my algorithm is because I treat thousands of patients and how they do. So there are creams and gels, and they've been around for a long time. Creams and gels for us in South Florida are very difficult because we sweat a lot and they're messy. And you have that risk of transferring testosterone cream to your children and pets and all that because it's topical. So it's very rare for us here to prescribe a cream or a gel, but I can't say that that's not an effective form for somebody maybe in the Midwest or somewhere if that's all the access you have. Complaints about that is people tend to think they grow thicker, darker hair in the area it's applied and things like that. What we found in the 70s, we gave men oral testosterone. We made testosterone pills and we prescribed it mostly to veterans. We gave them a lot of testosterone, and we found that when the body metabolized the testosterone through the liver, it broke it down into negative metabolites that weren't good for the body. So you won't find a testosterone pill. I say that 2 companies have come out. They think they have a pill now that can deliver testosterone. I'm still skeptical because the studies before where the liver is not a good home for testosterone. So that's how do we get it in the body and how do we get it in a way that's effective and can deliver the results we want? Brain health, sexual health, physical fitness, all these things that we're talking about. And that is either injectable, which kind of birthed out of COVID and the GLPs where people are used to injecting themselves, but women can microdose a small amount of testosterone like you do 3 times a week. It almost mimics the natural testosterone cycle for a woman, and they feel like themselves again.
Now let's talk about how you determine how much testosterone and the blood markers that need to be thoroughly examined before anybody is prescribed testosterone. So we're going to hear about the right way to do it. And then I'm going to talk about ways that this is also very much being mishandled by some medical professionals, not when it comes to women, but when it comes to young boys or young men, I should say. But let's stick with women.
We'll stick with women, and we'll have to talk about pellets. So we'll come back to that.
Okay.
Gayle doesn't want to talk about them because she's afraid of them.
I am afraid of them.
But we won't.
It might be good for you, though.
I do them, and a lot of people do them. But I think in all fairity, we'll come back to that. But so tell me your question again.
My question is, what's the deep dive on the blood in order to prescribe the testosterone or the hormone, I should say?
So there's a couple things. So when somebody gets a blood panel, and I know you've all done this, there is a lab value listed on there. People think that means normal. So it'll say lab value is 3 to 50 for testosterone on women. All that means is the statistical average of everyone that had their blood drawn during a specific period of time, but everybody's deficient. That's not normal. 3 to 50 is miserable. Normal, optimal can be 120 to 150 is our starting dose. But if we're really working on brain health, like you have depression or anxiety or pain like fibromyalgia, I may take you 200, 250. We may even go higher. So there's no negative. If you compare that level, say, if I just throw out 250, which sounds high to a man's normal is 9 to 1200. So at that level, you're not going to grow a beard. You're not going to grow a penis. You're not going to have androgen qualities. You're going to feel like yourself again. So our goal is really to find you and your deficiency.
So what are some signs for women that are maybe injecting themselves with testosterone or on testosterone that maybe their dosage is too much or off?
So it's interesting. When we started injecting testosterone, first in men, it's been around for men longer, they used to just give them 1 big shot a month. So we knew men were like here and then they were here. So then we went to weekly and they were here and here. And then we went to twice a week and we found a sweet spot. With women, since testosterone is an androgen hormone, kind of the same time that you have with puberty, we noticed if we didn't do it in smaller amounts frequently, we tend to have side effects, which was like large pores, oily skin, acne. So what we found is if we really broke it down and dosed women every other day, 3 times a week, that they didn't get any of the negatives of the androgen hormone, but felt like themselves again.
So it's about spreading it out.
Spreading it out in smaller doses.
Interesting. Now, and I know, and we have to get a little bit in the weeds, literally and figuratively, but I was reading something like it can be clitoral changes as well for women that might be overdose. Is that true?
So let's talk about overdose. Every once in a while, a woman will call me and say, "Oh my God, my husband injected his dose of testosterone in me." I don't know how it happens. It happens more frequently than not.
That a husband injects his wife with testosterone?
With his dose, a whole male dose.
Okay.
And it just gives you increased libido, maybe some clitoral engorgement for a day or two, and it goes down. So you won't overdose on it.
Okay.
But when a woman has been deficient in testosterone for a while, they'll have what we call clitoral atrophy. Their clitoris will atrophy.
It'll go in.
It just goes away.
What happens if it goes out?
Well, then they say, though, I can't orgasm. I used to be able to orgasm with self-pleasure. Now I can't have an orgasm. And it's really, really hard on them. What they find when we turn that hormone back on, they get clitoral engorgement, blood flow again, just very similar to a male erection. So then they get increased pleasure and sexual pleasure and all of that. So what they're noticing is what had become missing over the years is suddenly back.
So let's talk about, we talked about bone health. We talked about, but let's talk about the sexual benefits of testosterone for women.
So there are many sexual benefits for women. One is women will have desire again. So we forgot what that was like. So when you were young, 20s, whatever that was, you would plan that sexual event. Like you'd get dressed up. I'm going to wear this outfit. I'm going to put this cologne on and I'm going to seduce my husband, my man, my boyfriend. Suddenly we get to a place in our life and we're like, if you want to have sex with me, it's okay. That's it. Like, I'm going to go along with it because you want it. We still have pleasure, but we've lost that huntress in us. Like we're not seeking it. We don't need it for ourselves. Women stop masturbating. They stop having self-pleasure. And they're just like, it's just this extra thing we have to do. Men miss that. Men need their women to desire them. If they don't feel desired, they get in their head. What testosterone does is restores that person back to us. So suddenly I'm having sexual thoughts. I'm engaging in sexual activity. I always laugh. I tell my patients, I know I fixed you when you wake your husband up for sex in the middle of the night.
I like that. That's good. That's good. And your practice is a lot about sexual health, which sadly, people are like, oh, that's dirty or we shouldn't talk about it. But our sexual health is directly tied into our overall health. And I think women lose sight of that, especially women that went to Catholic school like me.
But God created sex for a reason.
Right.
It is meant to bind husband to wife and be pleasurable throughout our life. It's not just for procreation. The world has corrupted it, and there's a lot out there that's crazy and insane. But truly, I can save your marriage if I can save your sex life.
It's true. It really is true. Okay, so let's go. Can we switch gears? Yeah. No, let's talk about pellets before we go to men because they get enough attention anyways. The pellet therapy, I'll be honest with you, I'm not a fan of it. Only because, as you know, I went through so much with my thyroid and all the different health issues, and I lost so much hair that the thought of getting like testosterone getting in me and I can't get it out, or I can't manage the testosterone myself scares me because I just don't want to lose hair again if I can help it.
And that's perfectly okay. And that's what we meet people where they're at. Like every treatment modality is meant to be designed for you. So why do I do pellet therapy? Because I'm busy. I don't have time to inject. If I had to inject, I'd be testosterone deficient. Like it just wouldn't work. So pellets allow me to have an implant placed every 3 months, which is they're small. For women, a testosterone looks like a piece of rice. It's placed underneath your skin in the upper buttock area, and it delivers testosterone to my body as though my body's making it.
That's really cool. And then again, do the injectable. I have no problem injecting myself with it. And so I do see a profound difference. Now, I don't know for sure what's causing the profound difference because I am on this trifecta of estrogen, progesterone, and testosterone. So, what should women be asking their doctors? Or maybe you might have to go to a functional health specialist, somebody that really knows what they're doing, because traditional doctors might not know because it's just not part of the protocol. And then you just want to make sure you're in the right hands because there are a lot of healthcare professionals just doling out testosterone in ways that I don't feel are the right way.
So, first of all, if you're not feeling like yourself, it's probably a hormonal change. I would go that route before I would probably add a chemical drug like an antidepressant or that. Just make sure your hormones are in balance. The other thing is if you go to your doctor and you say, I'd like you to run a hormone panel and I would like it to include testosterone, and they say no, then you probably need to either go to a functional medicine place like us or go online and order your own because you're not going to be at 20 or 30 deficient in estrogen. You have plenty of that. That's not your problem. The other thing we see is they're like, oh, you think it's your hormones. I'm just going to give you a birth control pill pack, or I'm going to give you estrogen, but it isn't the problem. So you want somebody that's just not going to throw a prescription at you, but it's literally going to do the blood work, see where you're at. Realize these symptoms may be in your 20s and 30s and 40s before menopause is even close. No, also, it's not too late to start. You've gone through menopause and this is talking to you. You can add testosterone back anytime. My mom didn't start till she was 88. She's 95. And it gave her brain health, focus, got rid of her pain in her joints. She's a little flirtatious. Ain't gonna lie. She got us 30% off our meal the other day for something she said to the waiter, but that's good. But it gave her quality of life.
And I think that's so very important. And I was late to the game, like so many women. Some women haven't even entered it yet to the hormone replacement therapy and the testosterone. And one of the main things that I thought was really beneficial is that I did a bone scan and, one of these preventative bone scans, or not bone scans, but a whole body scan. And part of it was, a bone scan, and it started to show early signs of osteopenia. And you're like, don't worry about it. That's right when I started my hormone replacement therapy. You said, we're going to see this kind of dial back a little bit and you're going to start seeing your bones regenerate. And that's exactly what happened when I went the very next year.
I didn't get excited at all, did I?
No, I was panicked. I couldn't wait.
And that's because that's what we see, it's a combination with Gayle was the estrogen and the testosterone. And you do a lot of weight bearing exercise.
A lot.
She does everything right. I'll tell you, I know this episode's not about it, but the biggest longevity drug you can take is building muscle. And Gayle's really good at that. But, what is the controversy about what is testosterone? How can we not get it? And why doesn't insurance pay for it? I think is important. Insurance does have pharmaceutical grade testosterone available. It is made, though, with cottonseed oil. And we're talking about seed oils. And so we're injecting now this testosterone with seed oil. And people are like, but my insurance will pay for that. That one's free. And I say testosterone's not expensive. Don't take that risk. What I'm trying to teach people is doing testosterone is very, very cheap. It's not expensive at all.
It's not expensive, but you're now telling me because I can't remember. It's been well over a year now that you prescribed me testosterone and you gave me a vial. And because I only, dose what I'm supposed to dose and it's a very trace amount, but you say that's changed the next time I come back for.
So they decided, we found that since women don't take very much and we can sell them a men's vial of testosterone, that it becomes like a year's worth of medicine. And that was phenomenal. Then the pharmacies are like, well, no, you can't do that. So then
but what if I identify as a male to get the cheaper cost? Can I do that just for that, purposes?
No, but sometimes couples will come as a couple and they'll share a vial. Like they'll order one for the house because it's the same drug. But what you want to make sure, like if you look at your vial, it's either grapeseed oil or MCT oil. So it's better to know what you're getting, know how to do it. And then let's talk about this. There's a hormone clinic everywhere. You can get them online. You can fill out a questionnaire and get it shipped to you.
You get hormones.
Like, we see that. And a lot of times I see them come back like, okay, I got all this, but I don't feel better. Realize there's a bit of an art to it or a science. A lot of these companies are using just algorithms. So they're going to put in your age, the statistical average, and they're going to give you a dose. And they're not doing blood work. And then you're like, I don't feel good, or I just feel a change, or I don't feel that. And then you call them and they're like, well, just try more or try less. So realize that you really want to know your numbers. You do want to spend a little bit of effort on it. We don't want everything for free. We want to invest in our health, and we want to do it in a way that we're going to get results. So yes, men get free testosterone, but they don't get great testosterone.
They don't get great testosterone. And I did hear from talking to a physician that the insurance companies are finally clamping down on that. They're like, you talked about what's the testosterone. It used to be a pretty wide scope of who could get it. And now they're narrowing that down for men if they want to get free testosterone with cottonseed oil. But what's really alarming to me is the number of young men, like in their late teens, early 20s, who are probably the last people on the planet that need testosterone, who are being prescribed testosterone. How did that happen? How's that happening?
Well, to be honest, we're doing blood work on them and they have no testosterone.
They don't?
So we need to ask, why is testosterone depleting in our men at a rapid rate? We see that men are more feminine now than they've ever been.
Why? Oh, can I give you my conspiracy theory?
You know why.
Why?
Go for it, because we all know what's happening.
Oh, I thought it was because so many women are on birth control, and it's going into the water system, and people are drinking the water and they're getting exposed to hormones that they should not be exposed to.
So that is one of it. So every prescription drug people take, they pee it out. Can I say pee?
Yeah.
It doesn't get filtered out. So we can find in the water system drugs, chemotherapy drugs, all kinds. Even so, when somebody has chemotherapy, they tell you can't flush it down the toilet because they know how toxic it is. That's one thing. Then we put all these chemicals in our food that are endocrine disruptors. Well, our endocrine system is our hormone system. So we're eating things that bind with our endocrine system. Super simple things like you don't even imagine, pickles, things like that, like things you just think there's nothing in a pickle, it's just vinegar and salt. But knowing that, then the biggest thing is all these cosmetics that are coming out that women and men are applying to their body.
More so women than men, but now men are really getting into looks maxing.
They do. And we're getting all these, and people are like, it can't affect you. It's very, very cumulative. If I were to come into your bathroom and scan your products, I would probably find 80% of them were bad.
100%. Well, that was kind of one of the things that when my thyroid started to go off again, you're like, you need to be able to scan, you need to be able to look at what you're doing. It needs to be third party tested. A lot of what I was using, or especially the vitamins I was taking until I went third party tested, I didn't know what was in them or what I was applying to my body. Now I've changed that. Now back to the water. If you're drinking through a reverse osmosis system, which by the way, if you have one, you should have them put the minerals back into it or put them back in yourself. Does that take out a lot of these, pharmaceuticals and things that are in the system?
So yeah. So we invested in that, our home. It's an investment, but after they tested our water before and after, and now the water that we're drinking is clean and pure, and it's what we give our pets, and that's what we shower in now. And because your skin is the largest organ. So you can say, well, I drink bottled water. I'm going to laugh at that because it's in plastic, which BPC blocks your hormones too. The plastic bottles, plus the bottle was on a truck where it was hot and it melted in there. Like there's so much to it. And then people are like, well, I eat clean. Well, what about your mattress that has a foam topper, which is full of endocrine disruptors? All our Lululemon and spandex clothes that we love to wear, they're all full of these chemicals. So you almost go crazy when you think about it. And I don't want anyone to go crazy. You just have to make simple changes. I mean, I'm not coming to work today in burlap underwear and that, we need Lycra, we need things. But look at that constant exposure. So look at our kids and how we raised them and what we fed them and what we thought was okay. Suddenly the microwave came out and we microwaved plastic and fed it to our kids every day, the school systems and the food. And I know the current administration's looking at that, but that accumulation, if you look at our food, it isn't uncommon to have a food that says banned in the European countries.
Oh, it's insane. You go and people talk about it because I do these superfood socials all the time. And people talk about going to Europe and eating the foods there, and automatically they start to feel better because, like I've said on a different episode, you go through your local grocery store and most of what's on the shelves we should not be eating.
Eat like your grandmother cooked for you.
Right.
Simple foods. Get away from the quick process. Watch your restaurants. Know what they're doing. It's funny. We had dinner the other night and we had a young girl that had allergies. So we had to ask the wait staff. And the waitress came over and she goes, everything we cook is in bad oil. All the food we have is bad. We don't use real mayonnaise. Like we were all like, should we even eat here? And we love that restaurant. But she literally ratted out. And that's the economics of owning a restaurant.
Sure. The margins are very tight.
So is there garlic aioli made with mayo or is it made with soybean oil? Like you just don't know. And I don't think you want to know, but we all leave restaurants sometimes and we're sick. We don't feel well. We don't feel as good as we do when we eat at home. So you don't have to cut it out, but just realize if you're eating 3 meals a day out and your hormones are down, like these are works you have to do. And infertility in the youth is real. And low testosterone in 20-year-old males and female is
real.
It's prevalent.
I didn't realize that. I mean, I thought they were doing it just for muscle building and, roids and all that kind of stuff. I didn't realize ever that they're actually testing low for testosterone.
No, we've really moved away from testosterone only being for bodybuilders.
Okay.
It is really kind of mainstay now. Like the first thing somebody should think of when they're like, I just no longer feel like myself. Last year I weighed 140. This year I weigh 150 and I didn't change anything. I can't sleep. Testosterone induces sleep. I can no longer sleep. My brain is up all night long. I can't turn it off. Those kinds of things indicate that something's off. And it doesn't always mean that you need to go on testosterone supplementation young. It may mean that we detox you or find out why you're full of these or make some changes. Because these are kids that yet haven't even had their families. They haven't married or done anything, and they already have no hormones to function normally.
Yeah, that's very, very interesting. I mean, it's interesting too that, it's such an epidemic, especially the infertility issue, that the current administration wants to help pay for, people to be able to conceive. And I think it does all come down to the layering effect. It's like, Dr. Tami said, it's everywhere, that we're exposed to so much. So you can't just go and live in a bubble. But at the end of the day, there are actionable steps that you could do to reverse that layering effect that we keep doing with the products that we use, the foods that we eat, all those kinds of things. Cause that's very, very alarming to hear about the young men. And I appreciate you kind of opening up my eyes to that because I had no idea why it's so many doctors are prescribing young men testosterone. So are there different reasons for men and women to be on testosterone? I mean, we're very different creatures. So is it different? Why we need it?
So it's funny, we get the same benefits: brain health, heart health. As testosterone declines, cholesterol rises. So we know if we bring testosterone up, cholesterol comes down. So there's so many health benefits. I call it the longevity hormone, not because if you take testosterone, you'll live longer, but you'll have a greater health span. So your body will heal, repair, will do all the things it needs to do versus spending maybe the last 20 or 30 years of your life in and out of a hospital with sickness and disease. So testosterone is that key to helping your body recover. So men and women have the same benefits, but at different doses. And that's the key to it. It is really just identifying what's missing and trying to elevate it. What we found, testosterone is a pain reliever. People don't realize that. And so women get diagnosed with fibromyalgia all the time. That's the end dump for you. We don't know why you have pain, so we're just going to label you fibromyalgia and we're going to put you on medication to help you not know you have fibromyalgia. We give these same women testosterone and we bring it to an elevated level. Guess what? They don't have any pain. It goes away. Migraine headaches, same thing. I'm suffering with these hormonal migraine headaches. I don't know what they're from. We give you testosterone, we bring it to that right level, and guess what? They don't have migraines anymore. Those people have such a life transformation from testosterone. And they're the ones talking to everybody like, you've got to. It's not just a sex hormone for men. It is the hormone that keeps us healthy, happy, alive, repairing, regenerating. For me, I did neurosurgery for 20 years. I have arthritis in my hands. That's part of the side effect of that. When my testosterone is elevated, I have no pain.
That's fascinating.
As soon as that level dips down, I start to play with my hands because they hurt and I notice it's there. Did I get rid of my arthritis? No, but I have pain control. And that's really the beauty of knowing these hormones and knowing how to do them.
What about people that have concerns about testosterone and cardiovascular issues?
So that goes back to the whole FDA thing. So it was kind of mislabeled that people who take testosterone have a cardiac risk. We get it all the time. Patients will feel great, like, oh my gosh, my testosterone's great. I'm great. My cardiologist said my heart's going to explode and I'm going to die.
But that's not true.
It's not true. There's not a study that shows testosterone is linked to cardiovascular death. So there's a couple things. So if a male takes testosterone at a certain level, certain men will increase their production of red blood cells. And that is because the body becomes more vital. Red blood cells are made in the long bones. We know that it happens to about 30% of the men, and we monitor that. And we ask them to donate blood. They used to think that increased blood would cause problems cardiovascular, but there's no proof to that. What they know now is it may, just because it's extra volume, add to blood pressure. And so we try to keep it in that normal. But other than that, we actually have seen in the studies that men and women on hormone replacement therapy, whether it's just testosterone or testosterone, estrogen, and progesterone, have a greater health span and they live longer. And a lot of that has to do with the body converts part of its testosterone to estrogen, and estrogen is cardiovascular protective.
Now, what about women being prescribed and the possible or the question link to breast cancer? Is that a myth as well?
So it is. So estrogen itself does not cause breast cancer. If it did, we'd have more breast cancer in our 20s when we have a lot of it. But there are some breast tumors that have estrogen receptors on it, and that's where the confusing came in. So if you have breast cancer and they biopsy and it has estrogen receptors, meaning that tumor is fed by that, then we don't give you extra estrogen.
So if a patient comes to you, Dr. Tami, and they're like, how can I fit testosterone into my healthcare regimen? What do you tell them?
Start today.
Really?
Yeah. I think it's the biggest life-changing thing that we offer.
Testosterone.
We have more clients, more family, more everybody that found adding just that simple hormone back in their life has changed their marriage, it's changed their business outlook. I even have somebody running for political office now, all because of testosterone.
Really? It gives you that much mental clarity and that much focus and drive?
She said, when you told me I would be entrepreneurial or start a new business, I didn't think you meant I'd run for political office. I said, wow. So yeah, so she's blaming me, but hopefully she wins and we can blame testosterone.
That's phenomenal.
Well, because it brings us out. So the depletion, if you look at a depletion of anything, it's so gradual for most people. We don't know how to put our finger on what's missing.
So if that's your number one advice, what would you say is the biggest lie about testosterone?
Biggest lie about testosterone is that if women take testosterone, they'll begin looking like male bodybuilders.
Like a dude?
Like a dude. So there's so much of that. And there are some women who use large amounts of testosterone to compete at a very high level in bodybuilding. And they take that choice. But for the majority of them, I mean, Gayle doesn't look like a dude, does she?
No, I take
But we don't get a deepened voice. We
No.
don't grow male genitalia. We don't grow a beard. The only negative I would say is, testosterone is an androgen hormone. So with that, there's increased hair growth. So we may get a whisker or two or, thicker hair. And
I thought that was just me being Italian.
Well, Italians have it more than others, but aging also has it. So it's kind of a hard knock. But I'll tell you, women will say, gosh, I have a whisker or two. And I'm like, well, I can lower your dose. Like, please don't.
Right.
I can pluck. It's not something that pulls it out, but, we are turning that on. I also joke, if you come to me and your testosterone's 5 and I take you to 120, you're going to have a little bit of puberty.
Really?
Yeah, same thing it did when it turned on the first time. It is a sex hormone. So, you're going to have those raging hormones again. You might be a little sweatier. If you were prone to acne, you may have a pimple or two. That's just as we turn those hormones back on, the same thing that happened when you were 13.
But as you turn them on and the body starts to adjust, because I haven't really experienced anything other than, I definitely told you about the osteopenia. That improved. My muscle strength, I think sex drive is super high. So those are all things I haven't really seen. I mean, and I do get a couple little things that have to be plucked. But other than that, the only thing you do notice are the positive effects if it is dosed and monitored correctly.
So if done well, you won't have those side effects, and we can actually change your dose to help that. Probably the only complaint that is tough for me is if a woman is really prone to acne, testosterone can be difficult for them. But we even mastered that through the last year. I used to have clients that like, oh, don't give me very much. I'm going to get acne, that don't have acne anymore. And that's coming down to, our understanding of skin health and acne and improving that. So it is unusual for a woman to stop testosterone treatment because of side effects.
All right. It's a great discussion. Any final words as we drop the mic?
Just be patient. I think things are changing. I think care will be equal to both men and women going forward. Just realize that free isn't always best, would be my advice. And, take your health seriously on this. For less than a cup of coffee, you could bring your hormones completely back into balance.
All right. Until next time, your story,
your health,
your best life.
See you then.